Hi, my name is Jade Ainsworth and I am a young person from Barrow in Furness. I'm making this very informal video to support the bid for mental health teams in schools. I recently did a survey via social media which got over 700 young people's views and opinions on CAMS and accessing support. And I presented that to the CAMS redesign group of Lancashire and South Cumbria. You're probably wondering why I did that and why I'm doing this. I was with CAMS for several years and I've been with adult services now for a year, and I wanted to gather young people's views on their experiences with CAMS and not just my own, and get them heard and kind of help make a difference. 89% out of over 700 young people said that they had faced a barrier with getting support. This probably won't come as much as a shock to some people. It didn't me, as from experience it seems you have to be in a critical way for someone to even consider giving you some support. You have to be in a crisis, and a crisis differentiates between each individual. What may seem like a crisis to me might not be a crisis to you. Professionals from our perspectives don't want anything to do with you unless you are actively trying to harm yourself. But logically it shouldn't really get to that point of self-destruction before somebody gives you some help. We desperately need to tackle the fact that you have to hit rock bottom in order to receive mental health support, and it should not depend on how bad a person has overdosed or self-harmed or how low their low mood is. We are so accepting of any other body part breaking down except our brains, and that has created a world where mental health is not a priority over physical health, leading it to be ignored and misunderstood. I find that admitting you're struggling and trying to get support is the bravest and strongest thing a person can do, especially a young person, and for there to be barriers in getting that help just makes it much less likely for them to do it again in the future, which could just lead to further consequences. People who need help often look a lot like people who don't need help, especially within a school environment. Mental health looks different on everybody. It's not always presented in destruction or outbursts or poor engagement. It could be the quietest, most well-behaved student, and yet they are often unseen and not given any support. Young people need to get help sooner in order to tackle the problem before it manifests into something far bigger. I was struggling with my mental health massively at school and I was given no support. I was treated like I was a bad student, and I was excluded, put in detention, yelled at. My parents were rung up all the time, which just continued into consequences for when I got home. And as time went on, my mental health just plummeted. We had no mental health awareness assemblies. We were not educated on how to manage our mental health during stressful times such as exams. There wasn't anywhere quiet to go if you needed that time out. Students should not be having to sacrifice both their physical and mental health in order to keep up with their school requirements. The teachers aren't at fault here. They're unsupported just as much as we are, and there is no one to help them manage either. There should be something in place to help students manage their well-being, such as counsellors, drop-ins, support groups. Anything is better than nothing, and it doesn't even have to be professional as such. I don't know about anyone else, but if I was upset and wanted to talk to somebody, I'm not going to quiz them on what qualifications they have. I'm going to go to the person who is approachable, kind, understanding, and who knows me. Cumbria as a whole, or just Barrow specifically, needs more mental health support for young people, whether that's groups, day services, inpatient facilities. Barrow is such a small town and there isn't much out there in terms of support, especially in schools. CAMS itself has a huge waiting list and young people are on there for months at a time, whether even after a suicide attempt or feeling low. The spectrum is massive, and it would be so beneficial to have someone in school who can manage the people with lower levels of need making the waiting list much shorter, because at the moment CAMHS is all there is in terms of mental health support in Barrow. I had to go out of area when I was 16 years old, away from my friends, my family. I had to leave education because I had to get support for my mental health, and there was nothing in Barrow. I was no support in schools. I had to put all my dreams and ambitions on hold, and it wasn't until last year in December that I'd come back. Like, I've just come back, and maybe if I was given the appropriate support when I was 16, or just when I was in school when I was 15, if schools were more educated on mental health, if there was more support in Barrow, maybe things would have panned out differently for me. I wouldn't have had to spend the remaining years of my childhood in a child and adolescent mental health hospital, or the last recent 2 years hopping from home to home. We shouldn't really talk about the what ifs, because it's not like I can go back in time and get support for myself and any other young person who was going through the same as I was at that time, because there wasn't any. But I support this bid because you guys can change it today. You can help prevent any other young person from having to go through the same as I did, because I know I wasn't the only one. According to my survey, I was not the only one, and I cannot express enough how important early intervention is, or how important it is to have mental health support in our schools. Thank you.